Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. UK Health Secretary confirms to MPs that Nigeria and 10 other countries will be removed from its red list. Ogun State commences administration of booster COVID-19 vaccines. And Yobe State's government begins mass COVID-19 vaccination, expands vaccination sites. Thank you for joining us. 2 Pfizer doses offer 70% protection against hospitalization with Omicron. This is according to a South African study. The analysis released today by South Africa's largest private health insurance administrator, Discovery Health, was based on more than 211,000 positive COVID-19 test results of adults from November 15 to December 7th, about 78,000 of which were attributed to Omicron. Now, the 78,000 results are not confirmed Omicron cases, meaning the study is not able to draw conclusive findings about the new strain, which the World Health Organization, WHO, has labeled a variant of concern. Well, here's a further look at today's COVID-19 update.
385 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 11 states and the FCT, indicating a drop from the figures reported earlier. FCT logged the highest infections with 116 cases, followed by Delta with 115 cases. Akwa Ibom had 41, Ogun had 33, Cross River and Edo had 23 cases each, while Kaduna registered 10 cases. Other states, including Rivers, Plateau, Bayelsa, Oyo and Kano, registered a single-digit infection. The new tally has increased the total confirmed cases in Nigeria to 217,866. 2,330 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 210,076. There were 2 additional deaths resulting from COVID-19 complications in the last 24 hours, leaving the fatality toll at 2,983. More than 7.8 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 3.9 million persons have been fully vaccinated. The total global confirmed cases have surpassed 270 million, while deaths are beyond 5.3 million.
The United Kingdom government has said that all 11 countries will be removed from the UK's travel red list from 4 a.m. on Wednesday. Angola, Botswana, Eswatini, Lesotho, Malawi, Mozambique, Namibia, South Africa, Zambia, Zimbabwe and Nigeria are on the list. The red list was reintroduced late November as a precaution after the emergence of the Omicron variant, but Health Secretary Sajid Javid said it had spread so widely the rules no longer had much purpose.
And he's making a strong... Now that there is community transmission of Omicron in the UK, and Omicron has spread so widely across the world, the travel red list is now less effective in slowing the incursion of Omicron from abroad. So I can announce today that whilst we'll maintain our temporary testing measures for international travel, we will be removing all 11 countries from the travel red list effective from 4 a.m. tomorrow morning.
I thank the Secretary of State for being so generous.
Back in Nigeria, the Secretary to the Government of the Federation and Chairman, Presidential Task Force on COVID-19, Mr. Boss Mustafa, believes Nigeria is in the danger zone of COVID-19 pandemic and should strictly adhere to the COVID-19 protocols. The Secretary to the Government of the Federation made this disclosure during this year's Christmas Carol of 9 lessons organized in Yola by the Christian Association of Nigeria, CAN, at Adamawa State Chapter. He's also appealing to religious and traditional leaders to always create awareness to the people at the grassroots, as the country faces serious challenges if its citizens are not taking the COVID-19 vaccines.
In Adamawa State, we have so far just vaccinated about 2.85% of the eligible population. A state like Nasarawa State has vaccinated almost 16%. Ogun has vaccinated almost 12%. So we are still in the danger zone. I urge us as religious leaders to continue to preach that in our congregations, that we need to keep ourselves alive and by extension, keep our families alive.
Over in Ogun State, the government has commenced the administration of COVID-19 booster dose for eligible residents who have previously completed their first and second dose of the vaccine against the virus across the 20 local government areas of the state and 22 private facilities. The State Commissioner for Health, Dr. Tomi Koke, said this is important due to the constant mutation of which the Omicron variant seems to be the latest. She's appealing to residents to make themselves available at the healthcare facilities with evidence of vaccination for the complete doses before they can be administered with the booster shots.
The Presidential Steering Committee, in collaboration with the Federal Ministry of Health and the Primary Healthcare Development Agency, in line with experts' recommendation, have approved the administration of booster doses for people that have completed 2 doses of AstraZeneca, Moderna, Pfizer, or 1 dose of Johnson & Johnson vaccine. The Pfizer or Moderna vaccine, which are mRNA vaccines, are to be used as booster doses, regardless of the type of vaccine an individual had taken in the first and the second dose. Also, Johnson & Johnson can be given as a booster dose to the individuals that had Johnson & Johnson as their one and only dose. However, AstraZeneca vaccine is not to be used at all for any individual that took AstraZeneca vaccine for the first and second dose. So AstraZeneca will not be used as a booster dose at all.
Staying with vaccinations, Zamfara State Government is striving to meet the deadline target of 50% COVID-19 vaccination of its residents before the end of January 2022. The state's COVID-19 task force team said as much at a vaccination campaign and sensitization exercise at Tudunwada community of Gusau, the state capital.
Tudunwada and Gusau, the Zamfara state capital, was the next community to get a visit from the state COVID-19 task force, and is raised to vaccinate 50% of those that are 18 years and above by the end of January 2022. The team, led by the Executive Secretary of the Zamfara State Primary Healthcare Board, Dr. Ishmael Tuko, flagged off the community campaign at the Women and Children Welfare Clinic in Tudunwada community. The presence of traditional rulers at the program lends support to the vaccination exercise in Tudunwada. The Executive Secretary of the State Primary Healthcare Board says every avenue is being explored to get residents to take the jab.
A lot of activities which range from mass mobilization, a lot of career guidance, dialogues, sermons in places of worship, and all places to ensure that people are expected to go and take their vaccines.
The residents begin to respond, and their traditional head urges more of them to take the vaccine.
I want to use this opportunity to inform my people of Tudunwada and Gusau local government in general to come and take their own COVID-19 vaccination.
Zamfara State has recorded a total of 367 cases of the virus, and currently there is no active case of COVID-19 on admission in the state.
Well, joining us right now on the program is Dr. Donya Dubanjo. He's a public health physician. He joins us for more on stemming the spread of COVID-19. Thank you for joining us.
Thank you for having me.
Now, there's a lot of talk about disposing of vaccines, even calling on the help of different agencies. Talk to us about that, especially as many states kick off their mass vaccination exercise.
Well, I think it's a case of being careful, that you get vaccines just like any other drugs. We know from time that NAFDAC and other agencies will get rid of and destroy drugs that are expired. Sometimes people import such drugs into the country. And in this case, it's a case of receiving as donation. Vaccines are close to expiry, and by the time they come in, we're not ready for the use until it expires. So it's a good thing that they were not snake still into the public's, into the health centers and given to the public like that in desperation for enough vaccines, but rather they have been destroyed. So I think that is good. But we have to be very careful now, and I think the government has already made that clear, that if we're not ready, we don't accept any short life vaccines, any vaccines with short shelf life left, because they are also just donating them, not necessarily just because they are being nice, otherwise they could have donated the same vaccines long ago. Some of those countries have enough vaccines to vaccinate their whole population 2, 3, 4 times over. So they could have donated a long time ago. But when they also notice that this is going to expire, we're not going to be able to use it, then they donate them. So we could be better prepared to make use of them because we don't have enough. But in the situation where we can't make use of them, then we should do what we're doing, which is you have to just dump them.
But in terms of vaccine wastage, I mean, has this happened before in Nigeria, or is this a normal occurrence? And perhaps not even just for the COVID-19 vaccines, other vaccines here as well?
Well, it happens. Vaccines are drugs. So it's not a general thing, and we probably wouldn't have this knowledge or public awareness of it. But usually also, we don't get this kind of scenario under the routine vaccination exercises. Because one, we buy those vaccines, though highly subsidized, but because we also have our commitment, it's an order, it's a purchase order, both between us and Gavi, to the manufacturers. They have to deliver it to us at the appropriate time with enough shelf life. So usually that is not a known occurrence, usually. And then this is an emergency situation also for COVID, where people are buying and, rushing, and they had rushed months ago. They had paid up so many, for so many buyers of these vaccines from the manufacturers, in so much that many of them, because nobody knew what was going to happen with COVID, so many of them had made purchases that they didn't even need. And they just kept them thinking just in case we need it. So it's now as things are panning out that they're beginning to realize, there might be a problem here or there. Let's donate this one, let's donate that one. So for the other vaccines, which usually are given routinely, we don't usually have that kind of problem.
Let's get your thoughts on the decision by the UK to remove Nigeria and other countries from the red list by tomorrow. I mean, there is a possibility that another new variant of concern may spring up again. I mean, what do you see happening next, and how do we prepare for something like this again?
Well, some of us felt they shouldn't have acted as they did in the first place. And that's because, you see, by the time anybody knew about this variant, number one, everybody knew there were going to be variants. So were we actually thinking that every time there was a new variant, we were going to start shutting down? Again, nobody wants to shut down. And in all honesty, I don't think any country really can afford the shutdowns like that anymore. All the economies are destroyed, they're in shambles. So we all have to be very careful. And then we are told the world that vaccination will solve the problem. Even if it has not lived up to expectation of solving it completely, we know that it is offering protection, from severe disease and death. So when you have this kind of situation, then we should quickly just think and evaluate. Is our vaccination helping? And we should reinforce the confidence in the vaccination, if you will. Second thing is that if that means also looking into the future, you still expect more variants. So we are not going to be shutting down every time. Then, mind you, by the time this variant was discovered, it was in a few days it was clear that the variant was only discovered when it was discovered, but had probably been in circulation since at least October. That means for sure that you probably have that variant in almost every country, if not every country of the world already. If it's as infectious as it seems to be, then you probably already have it circulating, multiplying everywhere. So why then, which is the reason why the UK is now removing the countries from the red list or cancelling the red list, they're now saying, hey, it's already established here, so the red list really doesn't make much sense. It's not doing anything to stop this anymore. We just have to use other methods. And that's what we have to start preparing for, even for the future. What are the methods that might ensure, one, that you reduce the variants being produced, and two, that even if there were variants, we don't need to shut down because the shutdowns are unaffordable.
Indeed. We always appreciate your time on the program. Many thanks, Dr. Donyo Dubanjo, public health physician. Thank you for joining us on the program.
Thank you, Barry.
Still ahead, Yobe state government increases vaccination centers from 55 to 183. Please stay with us. Welcome back. In Yobe State, the governor, May Malabuni, has flagged off the mass COVID-19 vaccination campaign by increasing centers from 55 to 183, targeting 50% of the state's population for the end of December 2021. The governor was represented by his deputy at the College of Nursing and Midwifery, Damaturu, where he urged all stakeholders to support the exercise and ensure the proposed target is achieved.
Since the record of the COVID-19 index case in Yobe State on 30th April 2020, the state government has been working to strengthen measures to contain the spread of the virus, including ramping up vaccination in the state. So far, the state government has vaccinated only 64,000 out of the population of over 2 million in the state with either the AstraZeneca or Moderna brand of vaccine.
Because of the slow pace, we know that the Yobe State will have a population of over 3.7 million people. The slow pace of vaccination worldwide has become a matter of concern, especially to health authorities and international organizations. And the WHO has recommended now that all countries should strive towards vaccinating at least 50% of their population by year end. We know it is an ambitious target, but the aim is to ensure that we build herd immunity to be able to curtail the community spread of the COVID-19 pandemic.
But this will not slow down efforts of the state government, as they've now flagged off a mass vaccination campaign across all ministries, boards and parastatals, markets, worship centers and other public spaces. State government says there are also plans to expand the vaccination centers from 35 to 183 across the 17 local government councils.
Your Excellency, sir, to achieve this strategy, the State Primary Care Board, with support from partners, will expand its current vaccination sites from 55 to 183, which will be evenly spread across the state for easy access and bringing the vaccination to the doorsteps of the people.
As the year is ending and we are going to experiencing mass travels and gathering for festivities, this period is indeed a high-risk one for the spread of COVID-19. The COVID-19 vaccination is ongoing in all designated health facilities in the state. I appeal to our people 18 years and above to receive it and always observe COVID-19 prevention protocols. We should therefore join hands to protect ourselves by ensuring social distancing, use of face masks and hand sanitizers so as to reduce the spread of the virus.
Yobe is one of the states with the least number of the virus, with 502 confirmed cases and 9 deaths. This exercise is aimed at ensuring that no community is left behind as they continue in their efforts to curb the pandemic.
Away from Nigeria, just like the UK, there are reports that the United Arab Emirates, which earlier issued a directive to airlines that operate to Dubai from Nigeria not to fly passengers from the West African countries to the Middle East country, reversing itself. It says that the UAE attributed the reason for the initial ban to 36 travelers from Nigeria that tested positive to the COVID-19 virus. Well, our Dubai correspondent Maiwa Degoke joins us on the latest in the Emirates. Hi, Maiwa. Tell us, is it speculation or reality? Is Nigeria on the UAE's red list? What are you hearing?
I can confirm that Nigeria is not on the UAE's red list, especially as COVID is concerned. Countries that are on the red list from Africa are South Africa, Botswana, Eswatini, Lesotho, Mozambique, Namibia, South Africa, and Zimbabwe. So Nigeria is not on any red list. And we do know also for a fact that Nigerians traveled to the UAE from Lagos and Abuja yesterday and today as well. So we're all good on that account.
So tell us a bit more about what currently are the latest travel rules in the UAE, especially in the wake of the Omicron variant.
So particularly for Nigerian travelers, we do know that you've got to come with your negative PCR test. And then you also need to do another test on arrival. So that's what they're going with so far. But for residents here, you do know that vaccination rate is really high, going really well. But in the wake of Omicron, new rules that have been put in place and guidelines generally are that 18 and above are encouraged to take their booster shots. So that's what right now, Pfizer and the vaccines that are being given for the booster shot also were required to take PCR test every 14 days as opposed to 30 days previously. So for you to have your green pass on the COVID app, which is called Al Hosn app over here, to keep it green, which gives you access to certain places like government and the likes, and in other places like for you to access any public area, place, you will need to have a green pass on that app. And that means you need to do your COVID test 14 days after. So that's what we're going with at the moment.
So in terms of vaccination outlook, status report on really the number of people that have been vaccinated and also the age now, what would you say? I know that at the beginning, the UAE was leading in terms of vaccinating almost all of its population.
And it looks like it is still leading because we've got 100% that have now received one dose and 91.19% fully vaccinated of the entire population. So things are really looking good. Right now, what they're pushing is the booster shot that they say is effective against the Omicron variant, as well as other variants as well. So that's where we are at. But vaccination-wise, we're all good to go. Cases have still remained under 100 for several days now. So things look really good. The campaign, I would say, has worked.
All right, many thanks. Maiwa Degoke, our Dubai correspondent with the latest.
Thanks, Millicent.
And now China is reporting for the first case, or rather its first case of the Omicron variant of coronavirus on its mainland. Health authorities say a person in the northern port city of Tianjin tested positive for the new variant after arriving from overseas on the 9th of December. The individual, who was shown to be asymptomatic, is now quarantined and undergoing treatment in hospital. The first reported case of Omicron on the Chinese mainland comes 2 years after COVID-19, the disease caused by the coronavirus, was first detected in the central city of Wuhan. China has since imposed a zero-tolerance strategy, including mass testing, snap lockdowns, and extensive quarantines as a means to prevent any further outbreaks. Here's more on the global update.
According to South African researchers, a 2-dose Pfizer-BioNTech vaccination provides just 33% protection against infection by the Omicron variant of the coronavirus, but 70% protection against hospitalization. The first large-scale analysis of vaccine effectiveness in the region where the new variant was discovered appears to support early indications that Omicron is more easily transmissible and that the Pfizer shot isn't as effective in protecting against infection as it was against the Delta variant.
What is clear is that vaccinated individuals are experiencing milder infections in general, and that's supported by the data shown by the 70% effectiveness against severe illness, and also supported by anecdote where we're hearing that it's primarily the unvaccinated that are requiring admission and also that are requiring oxygen in hospital.
The 78,000 results are not confirmed Omicron cases, meaning the study cannot offer conclusive findings about the variant labeled of concern by the World Health Organization and now reported in more than 60 countries. Health authorities in northern China's port city of Tianjin have detected the first case of the Omicron coronavirus variant in the country's mainland. The infection was discovered in a traveler who arrived in the city from Europe. The patient is currently being treated in isolation in hospital. Singapore, which has vaccinated 96% of its eligible population, will allow up to 50% of workers currently working from home to return to their offices from January 1st. Officials are also urging the public to get booster shots amid concerns over the Omicron variant. Singapore has detected 16 Omicron cases so far. And over in Indonesia, the country has started administering COVID-19 vaccinations for children aged between 6 and 11. The Southeast Asian country is one of the first in the region to immunize the very young. And schools in the Netherlands will close a week early for Christmas this year as coronavirus infections remain high and hospitals struggle with a wave of COVID-19 patients. Infections in the country of 17.5 million have dropped from record levels following the introduction of the nighttime lockdown, but remain relatively high at around 85 per 100,000 inhabitants.
And you can visit our website, channelstv.com, for more updates, a better understanding of the pandemic and other breaking news. It's at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.